This presentation highlights our collaborative effort to enhance HIV screening and educate the community through targeted outreach at Hope Health Florence. The members of this group include Macy, Andrew, Michael, Jacob, Ashlyn, and Janae. The HIV program at Hope Health Florence is currently underutilized, even though many individuals in the community could benefit from its services. A major contributing factor is the low rate of HIV screening, which results in many people being unaware of their HIV status. Without a diagnosis, they are unable to access the medical and support services available to them. The program provides vital resources such as medical case management, medication assistance, and social service referrals. Increasing awareness and improving access to testing would help connect more individuals to these services, leading to better health outcomes across the community. To address this issue, our group proposes the development of a community outreach tool that brings HIV screening directly into at-risk populations. This could include the use of mobile testing units and hosting on-site screening events in areas with high need. We also recommend expanding HIV testing by including it in routine blood work during annual visits. These changes would help identify infections earlier, reduce barriers to care, and promote overall public health. The current standard of HIV testing at Hope Health Florence requires patients to request or be offered testing during clinic visits, which creates several barriers to care. These include lack of transportation, fear of stigma, and limited awareness of available services. As a result, many at-risk individuals are not being reached. The need for change was identified through ongoing observation of low engagement in the HIV program, despite its strong support services. This highlights a clear gap in early diagnosis and linkage to care. Currently, testing is mostly limited to those who ask for it or are identified as high risk, and outreach efforts have limited visibility in the broader community. However, there is strong support for implementing change. The CDC recommends routine HIV screening for all individuals aged 13 to 64, regardless of risk factors. Including testing in standard lab work would help normalize the process and lead to earlier detection. Additionally, mobile unit testing improves access and reduces stigma in underserved communities. Exploring billing and insurance options can support the long-term sustainability of both clinic-based and community-based approaches. Overall, our goal is to reduce barriers and connect more individuals to care by combining proactive outreach with policy-level changes in screening practices.
The most recent data I found of Florence, South Carolina specific statistics for HIV was in 2020 from the Department of Public Health. As of 2020, 866 people reported having HIV in Florence. Of these 866, 683 were African American. The CDC estimates approximately 13% of people with HIV in the United States are unaware they have it. Many variables contribute to people acquiring HIV and not getting tested or not getting treatment for the disease. Barriers to treatment exist, such as lack of transportation or a lack of knowledge of resources available to help diagnose and treat the disease. Unsafe sex practices tend to contribute to the majority of cases, as men who have sex with men represent the greatest number of those with HIV based on lifestyle factors with 303. Heterosexual individuals make up 262 of the cases of HIV in Florence. IV drug use is also a large contributor to the HIV cases in Florence, with 42 people infected reporting IV drug use. The stakeholders are patients, community members, healthcare workers, and educators teaching people about the available resources and treatment options available to them, as well as teaching safe sex practices to help minimize exposure risk. Nearly anyone in the community is a stakeholder in this. Our nurse-sensitive indicators are as follows. For the structural aspect, more accessible and routine screening. For the process, mobile screening units and inclusion of HIV testing and routine blood work can help diagnose those with HIV who are unaware they have it. For the outcome, reduced HIV rates and more successful treatment are the goals. Potential risk for patients are anxiety about results, as this is a life-altering diagnosis. Although rare, false positives can occur, which can negatively impact the patient by them believing they have an incurable disease that they don't have and facing side effects of these medications for treatment for no reason. And a potential discrimination for family and friends due to stigmas associated with having HIV are another potential risk. Some resources needed for change are funding for community screening, and a policy change to include HIV testing in routine screening, since HIV testing is not currently included in routine blood work.
For recommendation, we recommend to create educational materials such as flyers, infographics, social media content, and community partner toolkits. Research shows that culturally relevant, easy to understand information increases health literacy and reduces stigma around HIV. We recommend to do this to promote the importance of HIV screening and explaining available services at Hope Health Florence. Another recommendation we have is to advocate for Hope Health to adopt routine opt-out HIV testing. The CDC recommends opt-out routine testing regarding HIV for ages 15 through 65. Opt-out testing is a test where it is included as a part of routine medical care unless the patient specifically declines it. Patients are informed that the test will be performed as a standard procedure and that they have the option to refuse. This approach aims to destigmatize testing, increase diagnosis rates, and lead to earlier treatment by normalizing screening for all patients, regardless of their perceived risk. HIV screening should be voluntary and free from coercion. Patients should not be tested without their knowledge. Requirement of specific signed consent for HIV testing is not recommended. General informed consent for medical care is considered sufficient to encompass informed consent for HIV testing. Another recommendation of ours is to implement mobile HIV testing units, pop-up testing sites, and community outreach programs. The National Institute of Health completed a systemic review regarding mobile health interventions to improve the uptake of HIV testing for vulnerable and key populations. The studies show that the mobile health can be beneficial in reducing the number of undiagnosed persons with HIV. We recommend putting the mobile units, pop-up sites, and community outreach programs would be in areas with high rates of poverty, limited healthcare access, and areas with known higher HIV prevalence.
So my slide was on process, and we want to develop the community outreach tool. So for this, we would create user-friendly educational materials. The flyer could contain information such as free HIV testing availability, benefits of knowing one's status, services offered by Hope Health, along with locations and dates of mobile testing events. We want to assess language barriers and literacy. This ensures messaging is culturally sensitive, written in plain language, and available in multiple languages if need be. We want to collaborate with Hope Health for the marketing with the goal to provide a clear, easy to understand, and accessible outreach tool that can be shared online and in person throughout the community. Second, we want to implement routine HIV screening and primary care visits. We could collaborate with administration to integrate HIV testing into annual lab panels using an opt-out model. Ensure insurance coverage and billing structures are clarified with free or low-cost options for uninsured patients. By decreasing the cost, more patients would not opt out of the testing. The goal of that would be a sustainable system where HIV screening becomes standard preventive care. Third, we need to assess community needs and identify priority areas. Review local HIV prevalence data, screening rates, and demographic risk factors. Also, identify high-need neighborhoods, community groups, and barriers to clinic-based testing such as transportation, stigma, or lack of awareness. Finally, the goal would be a data-driven strategy that targets outreach activities in areas with the highest potential impact.
For the short-term outcomes, which would be the first 6 months, we expect to see increased awareness of Hope Health HIV services through community outreach programs, improved participation in HIV testing during mobile and on-site screenings for all demographics, especially the most vulnerable subsets, and reduced stigma associated with HIV testing due to normalization and visibility of screening efforts. For the second half of the first year, the intermediate outcomes we expect to see are a measurable rise in the number of individuals tested for HIV compared to baseline clinical data, earlier identification of positive cases, and timely linkage to care and treatment services, and strengthened partnerships between Hope Health community organizations and local health departments. For the long-term outcomes, covering the second year of the program, our intended outcomes is the incorporation of routine, opt-out HIV screening into Hope Health's standard primary care services, a marked reduction in undiagnosed HIV cases in Florence County, and a in HIV transmission rates through increased health literacy and awareness in the local community. Our suggested interventions are feasible. The initiatives are supported by both recommendations of the CDC and SCDHEC in regards to HIV screening. There is an availability of funding for the required infrastructure and an organizational commitment at Hope Health to quality improvement and to remain the flagship for combating the HIV epidemic in the area. In the first 2 months, or planning phase, we would focus on community assessments to identify priority locations for our outreach, developing educational materials, securing funding, and training the required staff and volunteers. In the launch phase, or months 3 through 6, we would be implementing the mobile testing unit in high prevalence areas, host on-site screening events at local sites, and begin integrating routine HIV testing into standard lab work at Hope Health clinics, as well as beginning to collect baseline data on participation rates in new HIV diagnoses. In the latter half of the first year, we would be the evaluation phase. We would evaluate the screening data we have collected so far to assess for program impact. Both staff and community feedback sessions will be held to assess unmitigated barriers affecting the effectiveness of the program initiatives. Lastly, we could track metrics such as early linkage to primary care for newly diagnosed HIV cases so they receive prompt treatment.
This project did not require an IRB review because it qualifies as a quality improvement project. The goal is to improve an existing outreach process at Hope Health using established CDC and DHEC standards, not to perform research or collect experimental data. There were no patient identifiers and minimal to no risk to participants. It is considered QIP because it focused on internal program improvements, evaluating outreach effectiveness through staff and participant feedback rather than research design. The project met QIP criteria. It improved an existing service, no randomization, and no PHI or protective health information collected. Under FMU IRB standards, this project is a Category 2, which is Educational Practices Program Evaluation. Projects like this are exempt from IRB review due to minimal risk and eternal educational improvements. On this slide, I'm highlighting the key ethical principles that guide our HIV screening outreach. We will protect patients' information at every step. All testing follows HIPAA, and any data used later for QI will be de-identified so it cannot be linked back to any individual. Participation is voluntary. We will make sure participants clearly understand the purpose of testing, the process, benefits, and any risk without pressure. We will prioritize do no harm. Our goal is to support early detection, reduce stigma, and protect the well-being throughout the entire process. We will ensure fair access for everyone, regardless of background, insurance, income, or demographic factors. All individuals will have equal access to screening, referrals, and follow-up support.